Humans can encounter rare and baffling diseases that challenge our understanding of biology. These conditions, which seem straight out of science fiction, profoundly impact those affected and intrigue medical professionals and the public alike. Despite their rarity, these diseases highlight the complexity of human pathology. Each presents unique symptoms and treatment challenges, emphasizing the fragility and resilience of the human body and the importance of medical advancements in alleviating suffering. Maple syrup urine disease. Maple syrup urine disease, or MSUD, is a rare metabolic disorder where the body cannot properly break down certain amino acids, causing urine to smell sweet like maple syrup. This condition mainly affects infants and can lead to severe neurological damage or death if untreated. Early diagnosis and strict dietary management are vital.
So we have to give him the perfect amount of protein every day. That's the exact amount that his body needs for the day, with zero overage.
The sweet odor results from the accumulation of branched-chain amino acids and their toxic byproducts in the blood and urine. Symptoms including poor feeding, vomiting, lethargy, and abnormal movements typically appear within the first few days of life. MSUD is inherited in an autosomal recessive pattern, meaning both parents must carry the defective gene. Treatment involves a low-protein diet and special formula with regular blood monitoring to prevent metabolic crises. Advances in genetic research and newborn screening have significantly improved the prognosis, allowing early intervention and reducing complications. Fish odor syndrome. Fish odor syndrome, or FOS, medically known as trimethylaminuria, or TMAU, is a metabolic disorder that causes a person's sweat, breath, and urine to emit a strong fish-like odor. This rare condition results from the body's inability to break down trimethylamine, a compound produced in the gut. Excess trimethylamine is released in bodily fluids, causing the distinctive odor.
Oh, you smell a fish today, Kellen. It's like...
The primary cause is a genetic mutation affecting the enzyme responsible for processing trimethylamine. This mutation is inherited in an autosomal recessive pattern, meaning both parents must carry the defective gene. Symptoms vary, with some individuals experiencing mild odors and others having more pronounced and persistent smells. Living with FOS can be socially and emotionally challenging, leading to embarrassment, anxiety, and social isolation. Treatment typically involves dietary changes to reduce intake of trimethylamine precursors found in foods like fish, eggs, and legumes.
All we can do is making sure she's not eating a lot of green leafy vegetables. We have completely cut fish out of our diet. There's no milk, it's all almond milk. She can have tree nuts, just not like peanuts.
Some patients benefit from supplements and medications that reduce trimethylamine production in the gut. Although rare, FOS significantly impacts those affected. Ongoing research aims to find more effective treatments and to better understand this condition. Stoneman Syndrome. Stoneman Syndrome, scientifically known as fibrodysplasia ossificans progressiva, or FOP, is a rare genetic disorder where soft tissues progressively turn into bone. This condition causes muscles, tendons, and ligaments to ossify, essentially creating a second skeleton that severely restricts movement and function.
We're turning to a human statue. We can't move.
The process usually begins in childhood and advances throughout life. FOP is caused by a mutation in the ACVR1 gene, which is crucial for bone formation and growth. Even minor injuries can trigger rapid ossification, leading to painful and irreversible joint and muscle stiffening. As the disease progresses, individuals lose mobility, making everyday activities increasingly difficult and leading to severe disability.
My jaw is completely fused.
My leg is fused at the hip.
That's the limit of motion I've got.
Currently, there is no cure for FOP, and treatment focuses on managing symptoms and preventing flare-ups. Doctors often advise avoiding activities that could cause injuries and using medications to reduce inflammation and pain. Research is ongoing to find more effective treatments and understand the mechanisms behind this rare condition. Living with FOP requires significant adjustments and support. The progressive nature of the disease means that those affected must continuously adapt to new limitations. Awareness and understanding of Stoneman Syndrome are crucial for providing adequate care and improving the quality of life for those affected. Laughing death, or kuru. Laughing death, scientifically known as kuru, is a fatal neurodegenerative disorder that once affected the foray people of Papua New Guinea. This bizarre disease is marked by uncontrollable laughter, tremors, and loss of coordination, eventually leading to death. Kuru is caused by infectious proteins called prions, which induce the abnormal folding of normal brain proteins. The disease was transmitted through ritualistic cannibalism practiced by the foray tribe, where deceased relatives were consumed as part of funeral rites. Ingesting infected brain tissue spread the prions, causing outbreaks of kuru. Symptoms began with headaches and joint pain, progressing to severe neurological impairment and emotional instability. Efforts to eliminate kuru centered on ending cannibalism. Public health campaigns successfully educated the foray people, leading to the cessation of these rituals and a dramatic decline in new cases. Despite its eradication, the history of kuru remains a poignant reminder of the intersection between cultural practices and infectious diseases. Water allergy, aquagenic urticaria. Water allergy, or aquagenic urticaria, is an exceptionally rare condition where contact with water causes hives and severe itching. This allergy can be triggered by water at any temperature, including sweat and tears, making it highly debilitating.
So it's there to prevent sweat because I am also allergic to my own bodily fluids which contain water, so I have allergic reactions to my own sweat, my own urine, my tears.
The exact cause of aquagenic urticaria is not well understood, but it is believed to involve a hypersensitivity reaction to an unknown substance in the water. Symptoms typically appear within minutes of water exposure, with affected individuals experiencing red, itchy welts that vary in severity. Routine activities like bathing, swimming, or getting caught in the rain can trigger painful reactions. The condition is not limited to any specific type of water. Both tap water and natural bodies of water can cause symptoms.
Little Ivy can only be in the water for up to 15 seconds before her skin starts to burn and develops blisters.
Living with aquagenic urticaria requires significant lifestyle adjustments. Protective measures such as applying barrier creams or taking antihistamines can help manage symptoms. However, there is no cure, and the condition often persists throughout life. Due to its rarity, research is limited, and those affected often feel isolated and misunderstood. Pica. Pica is a perplexing eating disorder characterized by the compulsive ingestion of non-food items such as dirt, clay, chalk, paper, or metal. It can occur in both children and adults and is often associated with other mental health disorders, nutritional deficiencies, or developmental issues. The exact cause of pica is unclear, but it's believed to result from a combination of psychological, cultural, and nutritional factors. For instance, individuals with iron or zinc deficiencies may crave and consume non-nutritive substances. Pica can also be linked to stress, obsessive-compulsive disorder, and pregnancy, where unusual cravings are common.
And I'm addicted to drinking paint.
Consuming non-food items can lead to serious health complications, including intestinal blockages, poisoning, and dental problems. Medical evaluation is crucial for individuals with pica to identify any underlying deficiencies or psychological conditions. Treatment typically involves addressing these root causes through nutritional supplements, behavioral therapy, and counseling. Treeman Syndrome, epidermodysplasia verruciformis. Treeman Syndrome, scientifically known as epidermodysplasia verruciformis, or EV, is an extremely rare genetic disorder characterized by the growth of bark-like warts and lesions on the skin. These growths, caused by an abnormal susceptibility to human papillomavirus, or HPV, can appear anywhere on the body but are most commonly found on the hands and feet. The condition often leads to severe disfigurement and significant physical discomfort. Epidermodysplasia verruciformis is inherited in an autosomal recessive pattern, meaning both parents must carry the defective gene to pass it on to their offspring. The disease typically manifests in childhood or early adulthood, with the warts growing progressively over time. These lesions can become so extensive that they resemble tree bark, hence the name Treeman Syndrome. The growths associated with EV are not only cosmetically distressing but can also increase the risk of skin cancer. Treatment options are limited and primarily focus on surgical removal of the lesions, although the warts often regrow. Other treatments such as retinoids and immunotherapy are being explored but have shown varying degrees of success. Living with Treeman Syndrome requires ongoing medical care and support. The condition's rarity means that research is limited, but increased awareness can help drive funding and interest in finding more effective treatments. Alien Hand Syndrome. Alien Hand Syndrome, or AHS, is a rare neurological disorder where a person's hand moves involuntarily, almost as if it has a mind of its own. This unusual condition often follows brain surgery, strokes, or neurodegenerative diseases that disrupt the brain's control over voluntary movement. Those with AHS may find their hand performing unintended actions, such as grabbing objects or touching their face. The primary cause is damage to the brain, especially the corpus callosum, which connects the two hemispheres. This damage can occur during surgeries for epilepsy or other brain traumas. Patients often describe their hand as acting independently, which can be distressing and disruptive. Managing AHS involves behavioral techniques to control the hand's movements, like keeping it occupied with an object. Although there is no cure, ongoing research aims to better understand and treat this condition. Werewolf Syndrome, hypertrichosis. Werewolf syndrome, medically known as hypertrichosis, is a rare condition characterized by excessive hair growth all over the body, including areas where hair typically does not grow. This abnormal hairiness can give individuals a werewolf-like appearance, hence the name. Hypertrichosis can be congenital, present at birth, or acquired later in life due to certain medications or medical conditions. The underlying cause of congenital hypertrichosis is often genetic mutations that lead to the overproduction of hair. In some cases, it's linked to other genetic disorders. Acquired hypertrichosis, on the other hand, can be triggered by drugs such as minoxidil, certain cancers, or metabolic disorders. The excessive hair growth can range from fine lanugo-like hair to thick dark hair resembling a pelt. Managing hypertrichosis primarily involves cosmetic procedures such as shaving, waxing, or laser hair removal to reduce hair growth. However, these treatments are often temporary and must be repeated regularly. The psychological impact of hypertrichosis can be significant, leading to social anxiety and self-esteem issues. Despite its rarity, werewolf syndrome has captivated public imagination and media attention. Exploding head syndrome. Exploding head syndrome, or EHS, is a sleep disorder where individuals experience sudden, loud noises or explosive sensations in their heads just as they are falling asleep or waking up. These sounds, often described as a bomb exploding, a gunshot, or a loud clash of cymbals, are not real but rather figments of the person's mind.
And you really think something happened, but my son was in the living room and he just said there was no explosion. It was just me, my head.
Although harmless, EHS can be extremely frightening and disruptive to sleep. The exact cause of exploding head syndrome is not well understood, but it is thought to be related to minor seizures in the brain, sudden shifts in the middle ear component, or issues with the brain's auditory processing during the transition between wakefulness and sleep. Stress, anxiety, and fatigue are known to exacerbate the condition. Symptoms of EHS include the sensation of a loud noise or an explosive sound, sometimes accompanied by a flash of light or muscle jerks. While the episodes are usually painless, they can cause significant distress and anxiety, leading to difficulties in falling back asleep. Many people experience EHS only occasionally, but for some, it can occur frequently. Management of exploding head syndrome focuses on reducing stress and improving sleep hygiene. Techniques such as relaxation exercises, maintaining a regular sleep schedule, and avoiding caffeine and heavy meals before bed can help mitigate episodes. While EHS is not dangerous, understanding and managing it can greatly improve the quality of life for those affected. That's all for today. These rare conditions illuminate the diversity and challenges within human health, underscoring the need for continued research, understanding, and support for those affected. Thanks for watching, and don't forget to like, share, and subscribe for more intriguing insights into the mysteries that intrigue and captivate us.